My name's Sarah King. I'm a Parkinson's physical therapist at Invigorate Physical Therapy and Wellness in Austin, Texas. So the most beneficial thing about physical therapy is the in-person part. So you're not going to be able to do all of your physical therapy from home, mainly because the physical therapist's job is to watch how you move, analyze that movement, and then prescribe you exercises that are specific to your needs and your individual movement patterns. So you can do some of your physical therapy from home, but you need that in-person connection with a physical therapist to get the most benefit. So research suggests that going 2 to 3 times a week for 4 to 6 weeks is the most effective for your Parkinson's symptoms. However, if your schedule doesn't allow it or you have some type of budget concern, just talk to your physical therapist, because even seeing them once a week can be beneficial as long as you're doing your exercises at home. It can be really hard to tell whether you're overexerting yourself or you're doing enough to really trigger change in physical therapy. So a couple of markers you can look for. The first thing I always recommend is trying to figure out the difference between hard and hurt. And if your physical therapy is hard, that's awesome. That's really good for your brain, because if it's not challenging you, it's not changing you. But if it hurts and you feel pain while you're exercising, sharp, intense pain, then that's a signal to slow down. The other way that you can know is that your soreness from your exercise should generally last 2, maybe 3 days max. If you're exercising and you're sore for 4, 5, 6 days and you're just completely wiped out, then you may need to scale it back a little bit and just do some gentle stretching. The last thing is that when you're exercising, you should be exercising at a rate that gets you out of breath and makes it so that you can only maybe say 1 to 2 words at a time, but you shouldn't be flat out exhausted. So hopefully that's a good place for you to start. My best advice for getting in and out of chairs, the first thing is that when you're sitting down, make sure you don't dive into your chair. And the best thing to do is to back up until you can feel the chair behind you. That way you know where the chair is and you can sit down safely. When you're trying to get out of a chair, the best thing is to scoot forward to the edge of your chair first so that your bottom isn't all the way back in the chair. You want your feet underneath your knees, if not behind your knees, so that you can rock back and forward a couple of times to get enough momentum to power up into a standing position. If you're struggling with freezing, especially in busy areas like the grocery store or the mall, and you find yourself really challenged to even be able to take a step or walk across the aisle, something that you can do is make sure that you stop, kind of shake out your stress, and stand up tall. That can help reset your posture so that you can walk fluidly again. If you really are having trouble even after that, you can use an assistive device, a cane, or even a walker to let everyone else around you know that you might be having some trouble. That way people can naturally clear a path for you. But if you are really significantly challenged with freezing, I can't recommend highly enough seeing a Parkinson's physical therapist, because they'll be able to identify your specific triggers and design an exercise program to help you rewire your brain so that those triggers aren't as significant when you're out and about. So obviously the best thing you can do is to go see a speech therapist who can help you with your swallowing. But some muscles that are involved in swallowing are between your ribs and of course your diaphragm. So one really great exercise you can do to improve your swallowing is to work on your breathing. And one way to do that is to bring your arms up behind your head, practice taking a deep breath, and then just stretching, exhaling from side to side. So inhaling in the center and then exhaling to the side, and just trying to deeply breathe and stretch out that rib cage and your diaphragm. The other thing is just to continue to work on your posture, because swallowing is a function of gravity, and the best way to swallow is to make sure that your head isn't too far forward and your shoulders aren't rounded. So you want to really practice those exercises that help stretch out your chest, strengthen your back, and help you stack your head over your shoulders.